not for the voucher, obviously, but for the administration.
As the analyst pointed out, some of it is an infrastructure issue, and in your own comments you pointed out as well, using an EBT system would be easier. I think it's the budget year. We do believe that it'll be above $16 million. There will be costs for administrative costs and automation. It's hard to know what those are in the absence of the infrastructure. And I think that there is concern about the ability to implement it in budget year given the lack of infrastructure. So it's likely a more long-term question, budget year +1 or beyond, because the department really, there's a lot of moving pieces here with the move towards EBT with other benefits where this may be more appropriate than in the current infrastructure or lack thereof we have for this type of a voucher program.
So does the department think, though, or I guess think that once that EBT structure is put in place and that this would be a more achievable solution?
Yeah, like the Department of Finance, we're not too sure. We have to do an assessment of that first, but my understanding is that once we do move to an EBT system for the WIC program, which is probably 2019-20 or so.
It has to be by 2020, right?
Around there. That's when they're in planning phase at the moment, but I believe that's when they hope to have the project up and running. That could be, but we do need to do an assessment first before we can give you a better idea.
So in 2020, after we've moved to an EBT card, then we could do an assessment on what it would be to add diaper voucher to that?
I would have to get back to you because I would have to talk to our IT experts on those type of process or so. So let me get back to you on that regard.
Is there? I'm sorry because I've been so frustrated, quite frankly, on getting some movement here. There is a real problem that we can provide a real solution to and actually help women move out of poverty, and we have nothing but basically the administration saying, we just don't know. Well, I would think by 2020, if we can go online with an EBT card, or an EBT card can carry the WIC voucher, why couldn't they carry the diaper voucher? And would you need additional money in the budget to get to the administration of that program prior to so that it could be enacted at the same time?
One thing I would just note about the EBT card is they are different programs, CalWORKS versus WIC. So
yes.
There's some complexity there.
But by law, right, we have to move the WIC program to the EBT card.
Yeah, that's correct.
So would there be a benefit in trying to ensure that as that happens by 2020, that this, if this body and the governor sees the light of day and signs this bill, that we could move the diaper voucher at the same time? I mean, is there a planning structure between now and 2020 so that we're not here in 2020 asking how do we now add this on? Because I've learned in IT in California, adding anything on once it's in place is going to cost a whole lot more money.
And certainly we could have those conversations. I know, my understanding for now, they're focusing on EWIC, given that that's the requirement. I mean, the WIC program, given that's a requirement from the feds, but like I said, we could have that conversation. I can't really provide more detail, given that I'm not the expert around those IT projects. And we'll have to consult with them first before I could provide you any more details about that issue.
I would just wonder if as we're doing that, we might provide, like in case in the future we want to add something else, provide for the software in a way that you could add additional. Wouldn't it make more sense to pre-plan for that rather than? This is the most discussion I ever had on it, so I'm using everything you'll give me.
You're right. It seems reasonable to the extent that if, like most IT products, from my understanding, if you add on if you give it the capacity, you can add on stuff on top of it, and it does seem reasonable. But like I said, I'm not working on the project, so I can't really provide you too much detail and specifics on it. And we're still in planning phase at the moment too. So our departments, DPH and OSI, are currently in the planning phase. We have a proposal for more resources to start that process, and it's too early for us to tell at the moment. So, like I said, if I could talk to them, I can get back to you on those regards.
I appreciate that.
And Jacob Hoare with the Department of Finance. I would just add that if this were to go forward now, there would probably be significant administrative costs to do this manually. So should keep having it incorporated into an IT system is probably a more efficient way to do this. Again, it's still an increased cost, and as Ms. Costa has stated, we're not on board with the increased cost. But wanted to mention that to the extent this is done now, it would have to be manual, most likely, and that would require some significant resources.
And do we know what resources it would take to add this to the planning of a future possible addition on the IT program?
As Mr. Lee said, that's something that we'd have to get back to you on.
Thank you. I appreciate that.
So Ms. Costa, just following up on this line of questioning, could you and or your staff please meet with Ms. Gonzalez to really identify or help us identify what the cost is based on what you know?
Mr. Chair, we'd be happy to do so.
Thank you so much. Senator Leno.
Thank you, Mr. Chair. I wanted to ask the LAO and get a response from Ms. Costa with regard to the SSP outreach for enrollment proposal on the Senate side. I understand this creates or can create a revolving fund of sorts benefiting from the interim assistance reimbursement, which is additionally federal dollars. So if you could help me better understand, I think we're leaving federal dollars on the table because there are eligible SSI recipients in California who are not receiving those federal dollars. And then additionally, and this is where I need your help, there is this interim assistance reimbursement program as well. There's additional federal dollars which can replenish this fund so we can do outreach to more potential SSI recipients. It sounds like a virtuous upward cycle. Can you put some detail on that, please?
Sure. Mr. Vice Chair, Callie Freitag with the LAO. Some background first on the Senate's proposal. The Senate's proposing $50 million this year and next to establish a funding source for this outreach program that would help counties. Some counties already have this program, but would bolster those counties and help counties create an SSI SSP outreach for enrollment program that would help transition people from CalWORKs, from general assistance, general relief, which is funded by the counties, or from the criminal justice system onto SSI SSP, which is a joint state-federal funded program. As for the revolving fund that you mentioned, it's my understanding that counties would primarily benefit from the fund source. So the way that this works is if a recipient is receiving GR, general assistance, general relief from the counties, then while they're applying for SSI, SSP, and if they eventually do get it, then the federal government will reimburse the county the amount that they were paying in GR to that recipient. So it does create some reimbursement. It requires some doggedness on the part of the counties to receive that, to get it back.
But they would have an incentive.
And that they would indeed. We haven't done a full analysis into this, but it would likely not result in any general fund savings.
I appreciate your point.
But again, not a full analysis.
Right, but to the extent that, and I would characterize this proposed $50 million investment as one-time upfront money to get this scheme in action so that it would be used to better enroll eligible SSI, SSP recipients. And that, as you've described, there would be, so we get those federal dollars for those, so counties would save some money. They could then go back to get reimbursed, and then they could get more eligible recipients enrolled. And to the degree that counties benefit, we are indirectly benefiting. And but there needs to be some upfront seed money to begin the process, and that's what this is.
That is also a correct characterization of how this program could work. I would also want to mention that SSI SSP is partially state funded as well as federally funded, and anyone who's eligible for SSI SSP is categorically eligible for Medi-Cal. So to the extent that there are people who become newly eligible for Medi-Cal because they are newly enrolled in SSI SSP, there may be additional state costs there, again, additional federal dollars, but there is a little more nuance to that cost-benefit calculation.
Thank you. And Ms. Costa, any response to that? It sounds like a very intriguing and creative program.
I would echo the analyst comments that I think we're still gathering information on this particular proposal, but our general understanding of the premise behind it would be that counties would be able to recover some of the cost. I think we are always cautious about these programs, although they're identified as one-time in nature, that there would likely be pressure in the future to continue to fund them. We'd note on this particular item that the $50 million proposed by the Senate does not take into account the costs associated to actually facilitate and conduct the outreach at the Department of Social Services. And we're estimating they would need 9 positions and $939,000 general fund to begin implementation of this proposal.
What was the dollar amount you put on it?
$939,000 general fund.
So a little shy of $1 million.
Exactly.
We could construct this so that $1 million came out of the $50 million, couldn't we?
Theoretically, if we reached agreement on the overall architecture of legislative augmentations.
Right. Thank you, Ms. Costa. I'll take that as a positive. For Ms. Freitag, could you get us some additional information so that we can better understand whether counties would get enough reimbursement to be able to continue this cycle on its own without coming back to the state for more? My understanding was this would be a one-time, and I understand Ms. Costa's concern. There's always pressure, but if we could understand, no, in fact, counties will get sufficiently reimbursed so they won't need any further state investment. It just, again, needs that initial investment to get the ball rolling.
We're happy always to work with your staff and see what we can provide in the time frame that it would be helpful.
Okay.
The only other thing that I would note for the counties is that absent the infusion of these state dollars, there are incentives for counties to want to do this outreach because of their general assistance funds. So one of our concerns would be similar to the comment regarding the suicide hotline. Counties should be doing this. And that in this case, they do have some financial incentives regarding general assistance to be doing this outreach at the county level.
I wouldn't argue that, but I think, as often is the case, counties just sometimes don't have that in their budget. And to the degree that we can assist them, we're doing something positive. And I would just think about one other possibility is whether there's any way, even if it's over time, if it is indeed going to be just a one-time investment to get this initiated, that maybe over time a small portion of that which the counties get back from the federal government to continue the program, a small piece comes back to the state, potentially even to pay this back. But at least we would have been the upfront money to initiate it to begin with. If that's in the realm of possibility, if you could confirm that, that'd be great. Otherwise, I still think it's a worthy $50 million investment. Oh, and then, Mr. Chair, if I might, I just had one other question with regard to the statewide emergency fund assistance. I know that we created statutorily this fund a few years ago. I think it was Assemblyman Fuentes, out of the need to address the millions of Californians who are food insecure and don't know where their next meal is coming from, that this proposal is to put a meager $2 million into that fund. Do you know to what degree other states have a statewide emergency fund assistance program? My understanding is, some memory tells me that some other large states have tens of millions of dollars for this purpose, and up until now we really have nothing, and the proposal is $2 million. So we could put it into a context of what other states are doing.
Sure. Unfortunately, I don't have specific numbers with me, but I am aware that other states do provide funding in addition to the federal dollars that California also receives, and that $2 million on a per capita basis is relatively less than some states. Other states, of course, do not provide any additional funding in addition to the federal dollars.
Right. So $2 million per capita, reflecting a 40 million population, is really just pennies per capita. And Ever-Ready staff has just showed me that New York State provides $34.5 million for emergency food funding, which comes out to, they're basing it on food insecure persons, to $12.50 per food insecure person. Massachusetts is $15 million, which comes out to almost $20 per person. And then we're at $0 with 5.7 million food insecure people. So I guess I have that information. I can save you that task. Thank you.
Assemblymember Olson.
Thank you, Mr. Chair. On the SSI-SSP outreach for enrollment at the county level, you indicated we would need 9 positions at the state level for oversight, I would assume, roughly to the total of about 1 million. Would you anticipate that those would be temporary state employees and the need for them would go away if and when in the following year we were able to just allow the county to do the outreach on their own, or would they be permanent, ongoing positions?
It will be temporary to the extent that it's what the state has required, but there are some reporting requirements too that might. So it could take at least 3 or 4 years. So,
Okay.
but overall, yes, it will be temporary.
Okay, so perhaps 3 to 4 years, but at that point you would anticipate the need for the positions to go away.
Right. To the extent that there is no additional reporting requirement by the legislature, then yes, there won't be any more
Okay.
resources needed.
Okay, thank you.
Assemblymember Bloom.
Thank you, Mr. Chair. Since it came up again, I want to be clear on where I am on the funding for suicide hotlines. I was not of the opinion that counties are necessarily the agency that should be paying for the suicide hotlines. As I'm sitting here today, I'm agnostic on that issue. What I'm not agnostic about is the fact that we shouldn't be pushing off whether or not this gets funded or who it gets funded by while people suffer the consequences while we're having a fight over it. So I think it's an issue that needs to get resolved, and these hotlines need to be back online and funded.
Okay, thank you. Shall we move on to issue 6? Aging seniors and persons with disabilities.
Thank you, Mr.
Ms.
Chair.
Freitag, yes.
Thank you. In this item, there are a series of legislative proposals that were not included in the governor's budget that are related to aging, seniors, and persons with disabilities. As you see at the top of this page, on page 16, both the Assembly and the Senate have included some funds for senior nutrition, which is 2 programs that already exist within the Department of Aging. And the fundamental difference here in these 2 proposals is the augmentation amount. The Assembly budget package also includes funding for adult protective services training for their workers, funding for a technological change related to personal care service provision in counties participating in the Coordinated Care Initiative, and finally, a one-time funding amount for the California Senior Legislature. So I'm happy to provide more context on any of these items, and we also have a possible compromise for the senior legislature issue, but I defer to the chair's direction.
Please continue on the recommendation.
Sure. So on the senior legislature, the California Senior Legislature is both a state agency and a volunteer body that gathers information to disseminate to legislators about priorities for older Americans. And it's funded primarily through the tax checkoff funding, but this year it's expected that they'll receive $60,000 in revenue, and this is a significant decline from their prior years. So if you are interested in continuing the activities of the senior legislature, then you may wish to consider adopting the Assembly's proposal of one-time funding, but also requiring the administration and the senior legislature to report back on a plan for long-term funding and how they may continue that in the years out.
Thank you. Ms. Costa.
The administration doesn't support the legislative augmentations offered in this package.
Any questions or comments from the committee? Okay, seeing none, we'll move on to issue 7. Child Welfare Services, Foster Care.
The committee does not support
Mr. Johnson.
rejection.
Good evening, Mr. Chair, and to the committee. Ben Johnson again from the Legislative Analyst's Office. And I'm on page 18 of the agenda, and I'll just outline a few legislative augmentation proposals around child welfare services. On the Assembly side, there's $32 million in proposed commitments, all general fund. The first being emergency child care slots for foster care children. This would provide $11 million in general fund for emergency child care vouchers for foster children while they await a child care slot in the wider child care system. The second is a program for foster youth pregnancy prevention, which provides $10 million general fund for counties to expand these services and provide an infant supplement for parenting foster youth. Next is a proposal that would modify eligibility for the Transitional Housing Program Plus program. And this would provide $5 million general fund and extend eligibility to include children who are in foster care between the ages of 16 and 18, but who have left foster care for permanency and then re-enter foster care. And it would allow them to access these services once they turn 18 and up to the age of 24. Next, we have the Chafee Education and Training Voucher Grants Program. This would turn the program into an entitlement and serve about an additional 1,000 individuals who apply for the grant at a cost of $3.6 million general fund. These are grants to attend higher education. Finally, on the Assembly side, we have a slight augmentation to the continuum of care reform. This would be a $2.4 million augmentation to fund counties to implement the Resource Family Approval Initiative at a higher rate. On the Senate side, there's $11.7 million in general fund augmentations. The first is the Bringing Families Home Initiative, which would provide $10 million in general fund for a county match program to reduce homelessness among families that are part of the child welfare system. And the next is the Public Health Nursing and Monitoring of Psychotropic Medication program, which would provide $1.65 million in general fund, which would be augmented by federal funds to provide additional staffing of public health nurses at county welfare departments to oversee and monitor psychotropic medication prescriptions. Those are the proposals, and I can provide any additional context that the committee may have.
Thank you. Ms. Costa?
Without reductions in other programs, the administration remains opposed to proposals that include ongoing spending.
Thank you. Back to the committee. Any questions or comments from the committee? Okay, I'm not seeing any. Then let's move on to issue 8. Department of Rehabilitative and Developmental Services. Ms. Bella? Or,
Meredith Worden with the LAO. On page 20 of your agenda, you'll have 3 legislative augmentation proposals related to rehabilitation in the Department of Developmental Services. One for the Department of Rehab for $705,000 to provide state-based funding for 3 independent living centers, and 2 Senate augmentation proposals for $5 million general fund in the budget year, $10 million general fund ongoing for the Developmental Services Community State Staff Program, as well as an augmentation for state operations related to contract services for the establishment of a dashboard for $300,000. Should the committee have any questions or would like additional detail on these proposals, we are here to answer those.
Thank you. Ms. Costa.
We don't support the legislative augmentations. I would note that we did include trailer bill language regarding the retention of state staff at the developmental services. And so we wanted to provide incentives to staff remaining at the developmental centers through the closure. This was intended to maintain sufficient staff at the developmental centers with the necessary experience to provide services for the remaining consumers.
Thank you. Any comments from the committee? This is our final item for the day. So Given that, then we are closing out the health portion of the conference committee. We will be resuming tomorrow at 11 a.m. here in this room. So with that, the committee stands at recess. Thank you.
Sweet. And what time are we getting together?